I want to first start and say that, I came this weekend as a speaker, but as people who I've had the opportunity to shake hands, I've also been a participator. And I sat in the audience listening for the last 2 days to the presentations. And, there's one thing I've learned, and people probably have heard this before: if you walk away from a seminar with 1 or 2 pearls, it's been worth it. And I can tell you that I've learned myself, there's a number of pearls that I picked up that I'm gonna go back and implement. And if I could everyone just give an applaud for the speakers, because I'm the last speaker. So if we could just applaud the speakers who spoke before me. Okay. I'm looking around at all the smiling faces. Smile, please. And I will tell you that one of my goals today, at the end of my presentation, is to bring some more joy, some more happiness to the people who are here tonight. And one of the things that I want to really, hopefully, leave with you guys are some additional clinical pearls. Well, I say clinical, some marketing pearls that you can take back to your office on Monday. So what we're going to do first, and I'm in my didactic. I have to change my clinical brain mind to my marketing. So if I talk from a didactic standpoint, I will pull back on the reins so that way I can bring out my marketing aspect. The information I'm going to be sharing with you is information that I've implemented over my 32 years in practice, but over the last 10 years practicing functional medicine, I've been able to, I'm not going to call it original, but I've been able to craft some, what I consider to be some pretty unique tactics or strategies that have just made a massive, a radical change in just the way that my practice has grown. And I'm very confident that if you implement the information I'm going to share with you, there's no ifs or buts, your practice is going to grow. But it's things that is going to be very, very subtle. And you're going to find that some of the stuff, you're going to say, aha, you just didn't put it into perspective that I'm going to share with you. So just kind of listen carefully, because this is going to be a little bit of a different, unique talk on more of the psychology and the thinking process of the practice on how to grow. We learned a lot of specifics, a lot of the, Dr. Osborne, and I forgot to apologize, some of the speakers, a lot of strategies. But these are going to be psychological tactics that I want you to really think about. I want to ask a question, and I want to have a raise of hands. This question is something that everyone already has. I'm confident everyone's going to give me the same answer. But a show of hands, how many people are interested in learning strategies on how to grow a practice? Sounds like okay. Obviously, everyone's saying yes. But here's the real issue, is how many people are going to take the information tomorrow, Monday, right, and implement it in their practice? Okay, now, thank you for saying that. We've all heard the term knowledge is power, but that's not true. Applied knowledge is power. Applied knowledge. So you could take this information, don't let it sit on your bookshelf and collect dust. I've seen it happen. I've been at fault myself. I've attended some seminars and I learned some information, put it on the bookshelf, and it collected dust. Don't do that. And we've heard this over and over and over this weekend. And I just want to emphasize what I'm going to be sharing with you, what Dr. Osborne shared with you, and all the different speakers. Take some of those pearls, make your list, your action list, and implement. 6 problems that I've encountered when I've done consultation with doctors is working a lot harder than they should. That's something that I've seen people do. You're just working way too hard. There's a word there that I want you to remember at the end of my presentation or throughout my presentation. It's called effortlessly. Effortlessly. I can take away the word how to flood your office with all new patients, functional medicine patients you can handle, but the word I want you to remember is the word effortlessly. And that's what I want to share with you. I see people, second problem, there's no real plan of action. People don't have any predictable plan of action to grow their practice. And again, you've learned some information this weekend that will make a big difference. Next is jeopardizing your credibility and reputation, incorporating black hat tactics. I can't go into detail what that means. It's just things that you and your gut may feel, this doesn't feel right. How many people have have just read something, they've maybe thought about implementing something, and it just doesn't feel right. What you don't want to do is get yourself involved in black hat tactics. Everything you've learned this weekend, and I was participating, was white hat tactics. These are things that's going to increase your credibility, increase your reputation, increase your trust in your community. You don't want to waste your time on marketing tactics that have produced little or no measurable results. And when you're looking at your stats at the end of the month or at the end of the year and you don't see your practice growing, obviously there's a problem. Now we see a deer stuck in the headlights. You know, I call it basically frozen in indecision. You come away from information, you get bombarded with stuff and you're not sure which way to start. The goal this weekend, as well as myself, is to present some strategies that are very effective that will take away the indecision. Next is the issue of cost of testing. I've seen that's been a problem with people, some of the concerns of cost of testing and patient acceptance. Again, I'm confident that when I'm completed, the information is going to show you, here's the word again, effortlessly, how you can effortlessly make a change and grow your practice. Now you have a choice to take the hard road or the easy road. Now the hard road is maybe what some of you all have been doing, but the easy road are strategies that I'm going to be sharing with you and strategies that you learned this weekend, and that's one of the specific goals that I want to share with you. Here's the agenda, what to expect. What you can expect, number one, is you can expect to walk away with 3 strategies that have been very effective. I know I'm repeating myself, just hang in there with me for a reason. 3 strategies that have been very effective that I've already incorporated in my office over many years. And these 3 strategies that I'm going to be sharing with you are time tested, and I've realized that if you practice these and implement these on a regular basis, you're going to see some pretty amazing results. Okay? The presentation is going to be approximately 1 hour. I have a lot of information to go over with you guys. So if you have any questions, when we get to the end of the presentation, feel free to either email me. I get back with people quickly, usually within a month. No. No, seriously, I get back with people quickly. If you could stop me in the hallway, but I just want to make sure that I cover everything I need to cover today. So if there's any questions, if I run out of time, just please email me a question. I'll get back with you. The 3 strategies are going to be broken up into Aikido marketing, local to global, and the stickiness factor, the ultimate strategy in patient compliance. I want to start the first strategy by giving a little short story about one of my patients by the name of Christine. Christine came to see me a few years ago, and she saw me strictly as a neuromusculoskeletal patient. And in talking with her and just working with her specific neuromusculoskeletal problem, she was sharing with me some of her symptoms, which to me were quite obvious with thyroid issues. And when I asked her some questions about these thyroid issues, she said to me that she had already been checked 3 times, and listen to me, 3 times by her primary physician, and her TSH was perfectly normal. And she said, the doctor told me, looked me straight in the eye, said, you don't have a thyroid problem. So following this first strategy, which is called Aikido marketing, I nudged, here's the word, I nudged the patient from a neuromusculoskeletal patient into becoming a functional medicine patient. And I went ahead and I ordered some additional testing. Now just look at this. What did I say? Her TSH was what? Normal. Can anyone see a problem there? Look at the total T3, free T3 total. Everything else was off the charts except, look at her TSH. What is it? Is it normal? Okay. This is not a clinical seminar. There's a reason why I'm sharing this with you. The TSH? 1.2. But if you look at all her other labs, everything else was out of range. Now, there's a point here. Why I'm sharing this with you is that when I sat down with her and I said to her, obviously something's been missed, and we need to move further into the clinical investigation. And this is not the time to get into the clinical aspects of what I did for the patient, but I will tell you that the clinical outcome was very, very good. But something was missed. But the question is, how did I move this patient from point A to point B? There's a term called the Aikido marketing, which I love this term. Aikido marketing comes down to applying the energy and motivation of the patient to accomplish a successful outcome with the least amount of resistance or energy. The key word, least amount of resistance or energy. You don't want to put yourself in looking like this. You see the guy, the dog? I love that picture. Yeah, the procedure is quite simple. Let me just read this. But underappreciated by folks who think they need to vomit their new functional medicine enthusiasm on the patient who needs what you have to offer. This is typically called push marketing, and it will scare away a lot of patients. The way you get your patients to respond to your ability to help them with open arms is to not force sell them. You don't want to force sell them on the fact that you have the golden goose that laid the golden egg. And what happens is you have you go to a seminar, a functional medicine seminar, you're just overly enthusiastic about what you've learned, and you just can't wait to just vomit this enthusiasm on the patient. So you have this neuromuscular. Now, I need to preface this, please forgive me. I'm a chiropractor. So this first strategy from a chiropractic standpoint talks about taking a neuromusculoskeletal patient and gently moving and nudging a patient into a functional medicine. How many people are interested in that? You know, so with that being said, just hang in there. If you're a medical physician, naturopathic physician, this strategy may not necessarily apply, but still the theory and the philosophy can still be very, very valuable. So the key thing is not to vomit your enthusiasm, not take this information from the seminar that you just attended and assume that the patient's going to buy into what you want to do. You have to follow something, which I'm going to show you. It's a neat saying. But before I go over that, just I'm going to give you the thinking process. First and foremost, one of your most richest sources of new patients are going to be your existing patients. People are already in your office. There's a lot of people sitting in your office right now who are seeing you from a neuromusculoskeletal standpoint who just don't know that you have other services available. They just see you as a back doctor, if you're a chiropractor, as a back doctor, a neck doctor. If you're an acupuncturist, they may see you one way. And what happens is you have this great service to offer them, but they just don't know you have it available. There's the term called a slippery slope. What you want to do is, how do you move this patient from a neuromusculoskeletal patient into a functional medicine? Let me tell you how it's done in my office. A patient comes in to see me with a cervical problem, a facet problem, a disc problem, a sciatica, a radiculopathy, whatever it may be. And when they initially see me, they're focused on that particular problem. But my initial intake questionnaire has other symptoms, other conditions that they're experiencing, but they're not necessarily seeing me with that particular problem. How many people have intake questionnaires that have other symptoms and other conditions? Now, realize also that the patient was also going to make note of medications that they're on. Now, if they're on an ACE inhibitor, if they're on a calcium channel blocker, if they're on an SSRI, if they're on Prilosec and Nexium, they have gastrointestinal reflux disease, they may not check off those other diseases, but you know from their questionnaire that they initially filled out that they have these other problems. But you're not going to vomit. I used that word earlier. You're not going to vomit this enthusiasm on the patient on the first visit. You know, you're sitting there with a patient with neuromusculoskeletal that's seeing you for a cervical problem and lumbar problem, but you see these have these other problems. You're not going to just the first visit start trying to force sell them on the fact that you have an answer. Does everyone see what I'm trying to say with that? You want to figure out, how do you get the patient and nudge them, the slippery slope? How do you nudge them? How do you minimize obstacles to get that patient down the slide, becoming a functional medicine patient? I'm telling you, this one strategy has revolutionized my practice. It's made such a huge difference, but it's so subtle. What happens is the patient comes in. I don't talk about these other conditions. I'll mention it as part of my clinical evaluation, but I won't necessarily tell them that I'm the guy or the woman who has the solution for these other problems. So what I'll do is I'll say, Mary, by the way, after I've treated the patient for a few visits, I'll say, Mary, I noticed that you're on Nexium, you're on Prilosec, you're on ACE inhibitor for hypertension. How are you doing?